Good day, everyone. This is Taranjeet Rathore. This is a new podcast from the Sikh Anesthesia podcast. So earlier my first podcast was about nurse anesthesia residents, SRNAs, who just got into CRNA programs. So they shared some of their experience, the application process, some wisdom around that. But now we have some seasoned nurse anesthesia residents. A lot of them are in their second year, so hence the title, Resident Roundtable second podcast. We have one of the residents who is almost starting her senior year now. So this is going to be a fun conversation, fun podcast. I'll just let them take it away, introduce themselves, what school they go to, and yeah, we'll go from there. Caitlin, take it away.
Hi, everyone. My name is Caitlin. I go to National University, and I just started my senior year.
Sweet. Erica?
Hi, my name is Erica. I go to Cedar Crest College in Pennsylvania. A junior who just started clinicals in September.
Danny?
Hi, I'm Danielle. I go to Mary Baldwin University in Virginia. I'm originally from New York City, and I'm in my second year, so I'm about to start 5 out of 9.
Hell yeah. Kyle?
My name is Kyle Credo. I attend Virginia Commonwealth University. I'm based in Northern Virginia, but I'm originally from Chicago, and I will be starting clinical in January, and I'm excited to be starting 4 out of 9.
And for those who don't know me, I'm Taranjeet Rathore. I also go to National University, and I just finished my first year. So I'll also be starting my junior year of my nurse anesthesia program, and I'll be starting my clinicals in April. So I just want to ask each and every one of you, and we'll take it in the same order that I just introduced you guys. So what inspired you to pursue a career in the nurse anesthesia field, and how did you lead your journey to CRNA school?
I'll start then, Taranjeet.
Yeah, please.
So my background is kind of different than the general. I've been a nurse for going on 10 years. My background is mainly emergency, EMS, and flight. I did like a little snippet year of surgical trauma ICU, but my last 4 years were all in flight. So I think that's what really propelled me to anesthesia. It really gave me a taste of that autonomy and independence. After a few years, I knew that it wasn't sustainable for the long term for me, just like family wise, more like generalized. And I knew I wanted the autonomy and the independence. So that's kind of what led me in that direction of anesthesia.
Right on. So that's one thing that I always give a national shout out, that we also take ER and flight nurses to our program. So that was awesome. Caitlin is a prime example of that. Erica, same question for you. What inspired you to pursue a career or a journey in the nurse anesthesia field?
So my journey actually starts from quite a while ago. For those of you who don't know me, nursing actually was not my first major, actually. I attempted a chemistry major and a graphic design major, believe it or not. And I accidentally fell in love with nursing. My stepmother is a registered nurse now, but at the time was a patient care assistant. Told me I should apply for a job. So I actually started as a patient care assistant. And it was actually a relationship from my father and stepmom. They go boating, and they had a colleague that they were boating with, and she was a CRNA. So she was actually the one who introduced to me what a CRNA was, shadowing, and got my interest peaked, because I literally applied to nursing school with this end goal in mind, to be really honest with you. So mine's been a journey for a little bit more than 10 years. Throughout that journey, I was an ortho med surg nurse for 2 years, and then I went to the ICU in 2019. And I think there's so many things along the way that just affirmed why I wanted to continue nurse anesthesia as my journey, besides the OR shadowing. Even during the pandemic at the hospital I was working for, our CRNAs came up to the ICU unit and just were mass intubating, doing our lines, working with our MDs. And I loved that collaboration that really took place at the hospital I was working for. So I think that was really great affirmation for me. And then I'm always someone who really loves case variety. And I got that a lot in the ICU. I came from a like mixed all in one ICU. It's a 32-bed MICU, SICU, CCU, CTICU. So I think, again, it just like spoke to like, this is the right journey. And I got a lot of like career satisfaction out of that case variety and even doing procedures as a bedside nurse in the ICU. So it just kind of confirmed that like, yeah, this was the next step for me, even though it started like 10 years prior.
I can resonate to that a lot. Like, anytime we had a CRNA drop off a patient, like they'll be giving a report. I'm like, wow, you're a CRNA? I'm trying to do that too. Like, I would have that spark. Can you give me any tips? How can I get into a program? So I can definitely resonate to that. And they would ask me, how old are you? And I'll be like, I'm 23. And then they're like, you got some time. I'm like, no, I'm trying to get in like today. But thanks for sharing. And Danny.
So my experience, I wouldn't say that I knew I wanted to be a CRNA from like the beginning or in nursing school. Like they never really introduced that career path to me when I was in nursing school. So my first taste of it was I had a bunch of coworkers who I guess started that journey to apply. And then I was like, oh, what's CRNA? Like you're to go back to school again. So that's what really like kickstarted my interest. And it wasn't until I did a medical mission trip in Honduras and then I got to really see what goes on. And that's my dog. And see like what a CRNA does and the amount of like pain relief and the satisfaction of just the job that you can literally change someone's life. So I went on this medical mission trip, and if you guys don't know, like medical mission trips, they go on like wait lists for people to get seen, and it's volunteered. Like all the staff is volunteered. They go down to like whatever area it is. And these patients have been waiting months to get care. And it's very like standard things like bread and butter kind of cases, maybe a lap chole, a hernia repair, some ortho cases like a total knee or eye surgery that are very standard in the US. But for them, they don't have that access to care. They live in very rural areas. There's not many hospitals, if any, where they are. So to see like after a surgery, they're just like so thankful, so grateful. They got the relief of whatever ailment they had. And to have like a role in that as like a post-procedure PACU nurse, I can only imagine how the CRNA felt. And then that's what really was like, okay, I need to do this. Like, this is something I see myself doing, and I want to be able to change people's lives. So that was my journey.
Thank you so much for sharing. I think one thing that you said was that really resonated with me was also that when I was going through nursing school, it wasn't really talked about a lot. Like the field of CRNA, like I never realized up until like a semester or two in it, everyone would talk about going to becoming an NP. NP was a big thing, but like no one really talked about it. I don't know what it was, but I'm glad I figured it out when I did.
I agree, Saran. It's like,
Yeah.
and if it was talked about, it's like forbidden fruit.
It was,
which is crazy.
Oh no, you need to be a med surg nurse for this many years, and you need to.
Oh, it's really hard. Like, are you sure you want to do it? Like, it's really
being
smart.
talked into it.
Yes, you really get talked out of it.
Absolutely. Kyle,
I think it also speaks to like if you do go into it, you want it. You know what I mean? Like if you've had that many people warn you about it, like you've done your research, you want this, which is what you need to keep getting you through motivation wise.
Yup. Got to find your motivation for sure.
Mm-hmm.
All right. So I guess for me, I became a nurse back when I was like 22, 23. I was start off as an LPN, CNA, working in the nursing homes. That's kind of where my nursing career started. Back when I got my associate's degree in nursing.
Like 20 years ago.
Man, I've been a nurse for 8 years. So I always knew that, I didn't really know what a CRNA was back then. I think the first time I actually started picking up on what a CRNA was, probably around the time when I transitioned from the ER into the shock trauma ICU when I used to work in Baltimore.
Mm-hmm.
Like Danny, I can resonate with her because it's like you get into the ICU. I'm like, all right, I want to be a flight nurse. I was like, Caitlin, I saw Caitlin on Instagram like years ago and I saw her just killing it. So I was like, all right, well, I'm trying to do a flight nurse too, trying to get all my certifications and whatnot, working in ICU. I got my ER experience. I was on that track. That's initially what I wanted to do in my nursing career because I'm an adrenaline junkie. I like the fast paced stuff. I like to be challenged every day. I don't like coming into work knowing the same thing, doing the same thing every time, which is what I really did a lot in my early nursing career. Working in nursing homes, same thing every day, pass pills, med surge, same thing every day, recover, pee, poop, dilaudid, pain relief, done. It got too repetitive. So that's why I went to the ER. That's where I really got my start. And but when I got to the ICU, my coworkers, were started talking about going to CRNA school. Like, did you get in? Did you get in? I'm thinking, I'm like, what are you talking about? But once I started kind of doing my research a little bit, I started snoozing around, and I was shadowed one time. Then I started to pick up on like what actually a CRNA was. And then we had, I always thought the people who came up to intubate and stuff like that were just anesthesiologists. They were physicians. But now I started picking up on it. I was like, oh, these are CRNAs that are helping my patients, intubating my patients. Like, we always had to call anesthesia for any intubation. It wasn't the intensivist on our ICU. So that's when I really got my exposure. And then, after I shadowed a little bit, and then 2 years later, I went to Diversity CRNA, and like after that, I was pretty much sold by going to that event. And ever since then, it's like, flight nursing was cool, but like Caitlin, I had that epiphany. I was like, I applied for my first flight job, and they were like, "We're gonna give you $32 an hour." I was like, "So you mean to tell me I'm gonna go from making $45 an hour right now as an ICU nurse to 32? I don't know long term if that's gonna work." So, so I never ventured into flights, and I went to anesthesia school. So that's me.
Before we advance any further, major shout out to Lena Gold and Diversity CRNA. Major shout out. She has changed so many of our lives. Well, thank you all for sharing. We're just gonna go ahead, and I have another kind of group, couple of more group questions, and then we'll go to like individual questions. But for I guess Caitlin can speak to this more, because she has actually like transitioned into the second year. A lot of us have not literally started our second year, like almost like we're in it, but like in the beginning. But you guys can also talk about it. But like, what have you seen, like your perspective on anesthesia, like from didactics to now you're actually doing the clinicals? Like, how has that evolved?
So I think, again, like my experience is a little different. I think didactic, at least from our school that I can speak of, really prepared us extremely well to be able to just walk in and kind of, at least the bare minimum, know what we're doing. I can't say enough good things about the way that they put an ultrasound in our hands the first week of school and used it pretty much like all the time throughout didactic and assignments and everything, because
Shout out
I
to
remember,
Dr. Kramer.
yeah, shout out to Dr. Kramer. I remember like my first week of clinicals, like first rotation, first everything. There was a patient that was on semaglutide, all that stuff. And we had done, at that point, I had done so many gastric scan assignments. I was like, oh, I'll just gastric scan him really quick. And everyone's like, kind of like, oh, that's an option. So it was super awesome to be able to like use the butterfly, take it out, do the gastric scan. I think we did a fiber optic intubation just in case, but yeah, first week, like right off the bat. So super prepared. And then I would say too, like the thing about the flight nursing that really did help me is that like it's really all about autonomy and independence. So like just feeling like you can make those decisions already and kind of primed really helped too. But didactic in and of itself, when you're stepping right out of didactic into clinicals, there you have so much knowledge in your brain that I get pimped. And the first thing I thought is, I don't know the answer to this question. Then the second thing is my mouth would just open and the answer would come out. And like, I have no idea where that came from. I have no idea. It's up there somewhere sloshing around. I have no idea where it came from. But like, you're in that study mode where you're just looking at things and learning things that you don't even know. And I mean, now I can speak to going into my senior year, I have lost a lot of that knowledge. I had to make room. But yeah, I think that didactic really does prepare you, even though you're slaving away hours and hours and hours thinking like, how am I actually going to put this to real life clinical? Like I haven't, actually done any nursing in so long. Do I even still remember how to be a nurse? And you do.
So advice is just be Caitlin, just open your mouth and just things will just come out.
That's the active recall right there.
That's the active recall. It's in there somewhere.
In there.
It's in there.
You do have to trust yourself. Like, trust yourself and knowing that, like, you have gotten this far. You are there for a reason. Like, I know it's really hard, but you are. Like, you're meant to be there. You're meant to do this.
I can speak a little bit too with Caitlin's. Since I started it in September, and I know programs are a little different. I will say our summer semester, so summer 3 of 9 for us, is like our boot camp semester. And I will say, evolving from the boot camp semester into this fall semester, I do really think, although we don't have all of the didactic knowledge, I will say that I think this fall semester that I just completed, the 4 out of 9, was a great semester to introduce clinical because you have enough foundation, but also like super big shout out to like personally, like my clinical rotation site, because I am truly getting those bread and butter cases. I'm getting the really great like intubation skills, extubation skills. Like there hasn't really been anything that they have given me that I haven't felt. Like you should never feel comfortable in clinical. Like, you know what I mean? Like I'm always going to be a little nervous, obviously. Like I definitely am not proficient at anything at this point, being 6-8 weeks in. But like I also felt really safe in knowing that like I was getting the cases that like really made sense for where I was at in my journey. So like huge shout out to the program coordinators for that and the assignments that they're giving us. And I know a lot of my other like cohort kind of feels the same way. Like it's been appropriate. It's not like they're throwing us into specialty rotations right away. So even if you don't get all the didactic up front, just know like it builds. And that's kind of like, I like things that build for me personally over time. So that works for my brain power and knowledge.
Thanks for sharing. I like that. I like that how they introduce you, like, kind of smoothly into it. And then you guys, can transition into more specialty cases. That's pretty awesome. Danny, for you, how do you think your second year has evolved from the first year?
Ooh, so my program, the way it's structured is our entire first year is online. So we do all of like I would say like core, like DMP type courses online. It's all, I guess like face to face, like you have to like go to Zoom and all that kind of stuff. So we had all of our foundational classes ahead of time before we started clinical, and we had sim lab before we started clinical in November. And they kind of just like threw us right into it. We're doing 3 days a week in clinical, on top of having like our regular coursework. And that just continues till the end of the program until we're full-time when we're seniors. So I think to like tag on to what Caitlin's saying, it's all there, right? You have like a million tabs open and it's all there. You just have to find the right tab. So you've learned all of this, like, it, especially foundational, like pharmacology, hemodynamic kind of things. But the adjustment for me was just that application. So, for example, we get put in a lot of bread and butter cases also, which I appreciate, like to Erica's point. So I've been in a bunch of like hysterectomies, hysteroscopies, like lap choles. So very standard cases where you have to be accountable for like positioning or like they're insufflating. So what's that going to do to your heart rate, your blood pressure, all of those kind of things. So you have all the pieces. It's just putting the pieces together of the puzzle. And it definitely has helped over time. Like the way I felt on week 1 is now not how I felt on week 5. I felt a lot more comfortable, especially just that repetition of seeing the difficult airways or seeing people that look like they would have a good airway. And then you go in and they're super interior and you can't get the tube in. So I think just taking all of those, like their little snippets, and then you're just adding to your tabs. Like, let me put this in this tab. So if I know someone has like a short chin, I'm going to be very mindful. Or if they have like big body habitus, I'm going to make sure I ramp them, because if I don't, I'm not going to be able to see anything. And it's just like compounding all of that knowledge, which I think is great about the field, is that you're always learning. There's always new research. There's always new things. But as a student, it could be very overwhelming. So I think the big thing with the transition from didactic to being integrated and doing didactic and clinical is just giving yourself grace. You're not going to come in and have an amazing day, but maybe you did one thing right, like 1% better every day is like my motto when I go into clinical. Maybe I didn't get the intubation, but I was able to like get ahead of like what I knew what was going to happen hemodynamically with the patient. So I knew they were going to get bradycardic when they insufflated. So I made sure to give glyco, or like those little small things, those little pearls. And then it just builds your practice. So that's how mine has been so far.
That is great. So like, if you ever go out, do you ever like look at people and be like, oh,
Yeah, I'm like, ooh, short chin. Ooh, I don't like this. I'm gonna hate intubating you.
it's this piece of cake. Come here.
Beard, difficult masking.
Oh, mine. Oh,
My
man.
hand's gonna
What
cramp.
would you do with
Like,
me? You
it's not
can't
good.
shave it. I always get that. I'll be like a difficult mask ventilation when and this is too cool. It's fine.
I had my instructor tell me she would McGrath me, so that was great.
There you go. There you go. So Kyle, I know you just started your second year, but how was that first year transition? Like, before like starting school and now that you're almost done, when you're done with the first year, how do you feel now, man?
I feel like from January to December, I definitely know way, way, way more than I started. I mean, I
Right.
knew the basics, obviously, of like just being an ICU nurse, but just knowing the in-depth knowledge, it's crazy to feel like, man, I think everything really resonated with me on our observation day, leading up to December. When I stepped foot in the OR for the first time on the other side of things and being behind the drape and watching my CRNA do all those things, it was kind of like, man, like all this stuff is like things started like buzzing off. Like, oh, Mac, oh, you're titrating down your CPAP. Oh, you're increasing your fresh gas flows. Oh, like you're giving cricoid pressure. Like all of these little things, like these little nuggets that are in your brain, like everybody else has said, they just start coming out. So now I'm like, oh, like, well, wouldn't you do this? Or starting asking questions, and my CRNA is looking at me like, all right, things are working up there. So yeah, yeah, they want to know that you're thinking. So I feel like that as far as my program is kind of similar to Erica's, where we kind of are integrated, where we start, we get a little bit of foundation. Well, actually, we get a good foundation that fall semester, which I just finished. That is like our boot camp semester. That's one of our hardest semesters. Now I'm going into the next hardest semester of VCU's program. So that really gave me a good foundations of physiology, pharmacology, basic principles of anesthesia, like positioning, fluid warming, all those things that you really start to learn. And then when you step into it, like I would say for me, we started to have some sim labs. It really goes to show that the theoretical stuff, all the book knowledge, all the didactic stuff is so important because that is your foundation. Because if you don't have the knowledge to speak to things, you are going to drown when you get into clinical. So when they ask you a question and you don't know the answer, either you go and look it up or you pull it out of your brain. Like you don't have time to think when the patient's on the table. So watching that happen really in sim and in the OR, it really set in. So I feel like I'm way up here now, as a nurse, as a clinician. I feel like, man, like I really know a lot more than I did and than I was at the bedside for sure. It was hard, but definitely didactic, take it seriously and make sure you really know what you're studying on a deep level, not surface level.
I think one thing that you said was that I resonate a lot with is now that I sometimes think back to my time as an ICU nurse, and I used to like question the providers. Why wouldn't they do this? Like, why don't they just do this? Why won't they just give me this drug? Or why won't they just, what I'm asking for? But now that I have that knowledge, like
Yeah.
pharmacology knowledge, it makes so much sense. Oh, that's why. Oh, this is why. So that's
Like
one
those
thing.
bells just go off. You're like, oh, I get it now. I get
Yeah,
it. I
I
even
get.
actually picked up a shift after work. After this semester, I picked up a shift.
Yeah,
I was walking in there. I was recovering a patient. I was like, oh, I know exactly what to do. Now I probably want to give this drug. Probably give this drug. Like going through all my orders, and I'm like, oh, that drug's probably not good for this person or whatever. Like things were clicking.
yeah,
So it was
it makes
cool.
sense. Makes sense. So another group question. We'll start with Caitlin again. So, what was the most challenging part for you, Caitlin, from being a bedside nurse, making money, to now in debt, not making any money, not sleeping, studying 25 hours in a day?
You make it sound so lovely.
Right? How was the transition?
Transition wise, like from didactic to clinical
No, just from
in general.
being a registered nurse to
Ugh. I mean, I think that it comes down to I had been out of school for a very long time. So the biggest challenge for me was learning how to study again, but learning how to study efficiently. Like the way that I studied in nursing school was not at all sufficient for how I studied during CRNA school whatsoever. So I had to like relearn, figure out what's going to work for this to stick in my brain. And then transitioning to clinical, I think the biggest thing is not really like the knowledge or studying, because you're now you have a year under your belt, you're used to that. It's more so balancing the personalities, the balancing you in it of yourself, like just sleep wise, taking care of yourself, not being so hard on yourself, because I think that that's so easy. And just like they were saying earlier, like take the small wins. There are so many things that we can be hard on ourselves for, but take one thing out of the day that you did right, because we're there to learn. It's easy to think like, oh, like, they were kind of hard on me. I did do this wrong, but it's like, you know what? I won't do that again, or I'll remember this for the next time. And it's all about your attitude and how you enter clinical each day. And if you are there with the attitude of, okay, well, I'm just going to learn today. I'm going to be open to whatever. It doesn't matter who I'm with. I'm just going to be open to learning.
I think that's a great attitude to have. Whatever adversity can be thrown at us, it could be a difficult situation, but what we have in control is our reaction, and how we perceive things and how we react makes
all the difference.
All the difference. And Caitlin is completely bullshitting when she says that she wasn't a good student. She is my mentor, and let me tell you, she has saved my ass so many times. They're like, oh, I have this exam, and I'm like, what do I do? And then she would give me some tips, guide me.
That's another good point, because like having people that you can go to for those 2-second text messages of, oh my god, I need this right now, help me, and like having that is very, very important, because it's all of us are people who understand what each other are going through. Sometimes our families at home, they don't understand. You need those people that understand that we're in the trenches.
And literally, like, I feel like you also grow so much as a person. Like this past year for me has been such a personality change. Like, there's a lot of stuff that would affect me, like with family or whatever, and now I'm just like, do you need me? Can you take care of it yourself? How bad is it on a scale of 0 to 10? Is it that bad? Okay, now they just take care of it themselves, because they know, like, oh, he's either studying or he's doing something. But that is so true. All right, moving on, Erica. Something important?
Yeah, so I think like challenging. So anyone who knows me going into this knows that I have a workaholic problem. So when I left the bedside in August of 23, like, I didn't hate being an ICU nurse. It actually was a little bit of like grieving for me. I know that sounds really funny, but I like to work. And I'm not usually someone who's really good with like online schooling. So again, like my first 2 semesters, the program I'm in starts in fall, and the spring semester, January. So the first 2 were like 100% pretty much online. And although it was like really big, like DMP stuff, I think it was still like just mentally hard for me in that sense, because I wasn't getting the satisfaction on a personal level of going to work. I think, okay, this is actually really starting. And now I'm like, oh, budget. I'm not saving anymore. Now I'm like watching my financial savings go down. That hurt. I will say in like defense, my program specifically allows students to work for the first 2 semesters up until our like boot camp summer semester in like May. However, I am stipend. That's a very long story. So basically, I would not have been able to receive a financial payment if I was still working. So anyone have any questions about that? Like, I'm very transparent about that. But for me, that's why I left bedside like 2 semesters earlier than most of my like cohort colleagues as well. So that was really hard for me, just like individually, because I was getting like a lot of, I don't know, like just stimulation at work. I liked going to work. It was just good for me as a person. Like I get a lot of just personal satisfaction with that. And like, again, I don't have a husband, I don't have a boyfriend, I don't have children. So like, I'm able to usually like take care of my patients in the sense of like, I can give all of that empathy and give everything of myself to my patients. So I was a little lost, not going to lie. That actually was a little hard for me transitioning, but I liked that the clock started. But it was hard, definitely hard, but it was nicer coming into like the summer semester because then it was like on campus 3 days a week. And then I got to like start navigating the like personalities of like the cohort and XYZ. But I'm not going to lie, I miss bedside. I miss my patients a little bit.
I'm sure they miss you too. But that is so true. I mean, first of all, thanks for sharing that. I feel like that was something because I feel like in CRNA school, people are from all dynamics. You know, some people have kids, some people have families, some people are, you know, they have their dogs or their cats. So thanks for thanks for sharing that. And I also do miss working sometimes, and I don't work at all. That was a lie. I'm just kidding.
I miss flying. I miss flying every
No, I don't work at all, guys. I only work when I only work. No, I actually don't work. I I work when there is off from school and they are really paying good money, and I'm like, okay, I'll come and help you out. Just being real here, just being really real here, because you know, once you have a house and other responsibilities, you know, everyone has a different story, but
And once you start clinical, you might not have that option.
yeah,
Because when you're 5 days a week, there is no option.
there's no option.
You know what I mean? Like, and if there
That's not-
is, like, I don't know how people are doing it.
Do what you got to do.
I mean,
Do what you got to do.
Do what you got to do. Like currently, well, we have 2 weeks off from school right now, so I was like, you know, I talked to A&M, you know, if you have any shifts in these 2 weeks, please put me on. I'll love to help you out and, you know, make some extra cash on the side, because why not? All these bills and everything, they don't stop.
I know, right? These credit card bills got to get paid. Got to meet these minimums.
Yeah. Right on. All right, Danielle, for you, how was it transitioning from bedside to resident?
So I would say the transition was a little bit softer because the entire first year of my program was online. So I still had the ability to work, but my program made it very clear that by exam 1, we knew exactly who was still working. Just because the time that you would be spending, you know, from taking you from like an 80 to a 90 or even like a 70 to an 80 is time that you're spending at bedside or whatever you were doing. So I was very strategic. I did still work, but I was very strategic about when I picked up shifts. I didn't work bedside. I worked at an IV clinic, and he knew I was in CRNA school. He's an amazing boss. So he was very flexible with my schedule. If we didn't have patients, he let me study. Like it wasn't like a thing. And then I made sure I planned my shifts after exams. So if I had an exam on Friday, then I would go in Saturday, Sunday, because I had some time before the next exam. That being said, the biggest adjustment for me, like Erica said, was the financial hit. I won't say that I prepared financially for CRNA school. I definitely enjoyed my life as an RN. I had a good old time. I got it out of my system. It was great. But with that I didn't save the money that I've seen like a lot of my peers do. I would say that would be my one gripe, that I wish I did have some pocket of money set aside in case of emergencies or anything like that. But, you know, we're living on loans and the loans are doing what they need to. So that's great. And then I guess to that other point, the other adjustment is just the life adjustment that I'm personally someone that has like huge FOMO, which is also glad why I go to school in a different city, because I can say no because I don't live there anymore. If I went to school in the town that I'm from, I would have a really hard time saying no to hanging out with friends, going to dinners, even like family obligations. I have a large family and they love seeing me and spending time with me. And to say no to those things, I knew it would be really hard for me. So it worked out that I don't live at home anymore. So I think that's a really hard thing. Like Taryn, like you said, like family reaches out to you and they need help with things or things are going on and you're the person. That's kind of how it is in my family also, that I'm always available. But when you go to school, you're not available anymore because all your free time now is studying, catching up on lecture, study groups, like all of these other responsibilities that take paramount now because yes, it's like a graduate degree, but also you're in the hole for a lot of money. And this is not something that you want to take lightly. So that was like the biggest, I think, adjustment, the finances, and then learning to say no to things, to family, to friends, stuff like that.
And also saying yes to a podcast. That's
Always yes
also
to the
very important.
podcast.
That's also very important. Thank you for sharing, Daniel. Thank you really for sharing. I feel like all of us feel that. All of us really feel that. The financial thing. So I had two options: either to buy a house or put all my money towards tuition. But then I thought maybe buying a house would be a better idea. You know, build up equity and whatnot. But now that I just saw my property tax, I was like, California ain't it. California ain't
This
it.
stings.
Wait, but you might not be wrong though, because now you have an asset, and you can
Yeah.
always do like a HELOC.
No, that's okay. Yeah. So someone was just telling me about that.
Yeah.
Telling me about that. So actually, before I do my taxes for next year, I'm going to talk to a CPA and maybe we'll do HELOC. But yeah,
Yeah.
that is that is one thing I'm looking into. Moving forward, Kyle, what was the most challenging part for you?
I guess in quick, short, and sweet, piggyback off of Danny with the finances. Like, I was one that I was trying to save. I was trying to pay off my car, but life just happened, and like just trying to get into CRNA school, I was spending some money, like just with the acceptance, deposits, and then you got trying to retake classes. I was finishing up my master's, so I didn't really save much. I mean, I tried. I mean, I had like a little stack of cash, like 5 to 7 grand. That went very fast, by the way. It goes very fast. So, I think for me that was really an adjustment, and then also just actually taking out the loans and looking at them. It was like I don't think I've looked at my loan since the summer. Like I just like click the button, take the money, don't even look at it anymore. Like because I would always go start spiraling, and then my fiance would have to pull me out of the depths of my spiral because I'm just like, what did I just do? You know what I'm saying? Because I'm a person I really don't like debt. I've never really, I was a person that never really had more than like maybe 2,000 on a credit card. So that was really a hard adjustment for me, and also go to a state of having a steady income. I'm about to get married, and I was like, oh, now I ain't got no money, and I do have to rely on my partner, for some things. Shout out to my fiance. Love you. She's definitely been like, a good support system for me. So I got to give her love for that. But yeah, I think the finances were a big thing for me, for sure. Uh, as far as other things, I think for me personally, I'm a person, growing up, I was really sensitive to criticism, and I think that's something that personally I've been working on for the past like maybe like 2 or 3 years, because I actually have just started to recognize like I am very sensitive to criticism. So I think one thing for me that I really had to, adjust to and make sure that I keep in check is my responses, my reactions to criticism, which is why everybody says like emotional intelligence is so important, But I think the biggest thing for me was just knowing that like, it's okay not to be right. It's okay to be corrected. It's okay to, not know everything, because I'm always naturally so hard on myself. When I don't get something, like I am frustrated. When I fail at something, I am stewing over it for like 3 to 4 weeks. I will still think about it. So I think for me mentally, it was getting that in check. But I think a lot of it was just my self-actualization. Like I acknowledge it. I recognize it. And I think a lot of people, when they go into CRNA school, they don't recognize those things about themselves, which is why they're not successful clinically, because personality is everything. So that's definitely was a transition for me. But, just being humble, is a great thing going into school. So that actually helped me just kind of like transition. But the criticism, you're going to get it in school a lot, even in study groups. Like I'm not even in clinical yet. And, when somebody tells you like, no, that G protein couple receptor is wrong. No, it's GS. It's not GI. It's like you get humble because you're in a room with people who are just as smart as you. So, keeping that, in the back of your mind that it's okay. You're gonna be wrong a lot, Kyle. You're gonna be wrong so many times. But just say, okay, I'll look it up. Keep it moving.
I think you nailed it, man. You nailed it. You hit a lot of points, which are because we all are very type A people here. We all are the best of our best. ICU nurses. A lot of us are here with so many years of experience, and to go from that to like being just naive and just not knowing anything in the field of anesthesia, a lot of terms, and then when you do get some constructive criticism, it is hard to accept that sometimes. So that's why I said, it is a lot of personal growth. It is a lot of personality growth as well. So I'm really glad of this growth that I'm seeing in you guys and in myself too. So we'll jump into some other fun sections now. So I'll just switch up some things now. Don't feel that this is targeted towards anyone else, but it's just random. But and some of these questions will be catering to people who have more clinical experience and whatnot. But let's start with Danielle. How has your background or identity influenced your experience in CRNA school and your clinical practice? You can share a little bit about your background if you would like.
So background wise, I am Filipino and Black. So I, like you and Kyle, I went through diversity CRNA. I am a product of the amazing Dr. Gold. So that really is what opened my eyes to the profession and how lacking we are. Like, our providers need to reflect our patient population, and they don't. And that's not just in CRNAs and like in anesthesia, that's like universally in healthcare. We need to look like the patients that we're serving. So I thought there was a huge gap there. And then personally, in my family, I'm the first of my dad's kids to go to college, let alone grad school. So I'm the first in my whole family. It's not a thing. It was in the neighborhood I grew up in. It just wasn't promoted. It's like, okay, you're going to go to high school. And that was kind of like the cap. Like that was the expectation. And my parents wanted more for me. And I inherently wanted more for myself. So then I went to nursing school. I did all the things. So I think that really influenced me, especially in my program too, because they're big on diversity as well. They partnered with Diversity CRNA. And I'm not the token POC in my class. And I really appreciate that because I hear experiences from my other friends in other programs, and they are the token, they are the person. And I'm white passing. I'm not even like, I would say, a more noticeable person of color. So I can only imagine how they feel in their experiences. So the fact that I'm part of a very diverse class in comparison to other programs, I can really appreciate that. And I think it gives us a sense of pride, and we want to see each other do well, and we're going to do well because the expectation is a little bit more because we're one of few. So that's my experience. So.
Thanks for sharing that. I think for us, National University, Caitlin can agree to this as well. I think our classes are very diverse as well, from gender, age group, whatever setting you're in, like kids, no kids, age wise. I'm the youngest in my class for cohort 6, but we have someone who's like in their 40s, almost touching 50. I think so. It is very diverse in that way too. It sucks that I guess I am the turban pod diversity guy because there's a lot of us, but it's because being a Sikh is actually very rare. So, but I do, sometimes people do, oh, maybe you're the diversity card, but whatever it is, you can't really change people's perspective. You really can't. And I'm just gonna do me, and then I'm here, I earned this spot. But it feels really good that like this coming cohort, there's like 2 to 3 Sikh people who will be in the cohort 7 of National University. So it's good, when it's like people see, they get inspired. What we're doing here right now is to inspire the future of us, right? So it is first. So thank you everyone for being here firstly, but thanks for sharing, Danielle. And what a deadly combination, huh? Black and Filipino. Wow.
I'm like Blasian. Can I tell people?
Right.
You
All right.
paved the way.
All right.
You paved the way for you. You paved the way for your next cohort, man.
Hair. She just did that thing with her hair. Right. All right. Kyle, how do you think, well, Danny touched on this a little bit, but how do you think, like, in terms of diversity in healthcare, particularly in the field of CRNAs, how does it impact patient care?
I think it impacts patient care. Like Danny said, you need people who look like you in order for people to feel comfortable. And I think I'll give an example of, let's say, you're a CRNA and you walk in to pre-op your patient, and you see in your patient, you see that anesthesia provider, that CRNA, and they look just like you. I'm not saying that a person always has to look like you for you to get the best quality care. It's not what I'm saying. What I'm saying is it's that level of comfortability, because speaking from, the African American community, since history, there's been, things placed against, the African American community in healthcare, in society in general, and all these barriers and, these discriminatory and microaggressions that we've always had to deal with, going through the healthcare system. A lot of Black folks don't trust the healthcare system, and I've even witnessed, being, a nurse and walking into the ER, and, a patient who is African American, and they walk in and they see me, they're like, I live in like deep North Carolina, and like, where did you come from? And so it's like that one of those things where it's like you can like just breathe maybe for a second. You're not anxious. You're more open. You're more open to, telling, somebody about your health problems or stuff like that, and not fearing being judged and things like that. You want to have patients who are open to, receiving care no matter the color. But when you see somebody who looks like you just feel like you're at home. And that's just being honest. You feel like you're at home. You feel like you're safe. You feel like, somebody's really looking out for you because they understand where you come from, whether you're, Filipino, whether you're Caucasian, whether you're, Sikh, whether you're Indian, any walk of life, you just feel that sense of home, like this person gets it, and there's nothing in this world that can match that, for diversity in healthcare. So I think for, our profession, and just realizing even years ago that, man, there is, less than 4% of CRNAs who are African American. Like once I saw that number, I was sold, because already you come into a nursing profession where you aren't, the most predominant one. I remember walking into, I worked right outside of Charlotte. I worked in some of the more rural ERs. I was the only Black trauma nurse when I went to the ER. I was the only Black one working in trauma resuscitation at my hospital at the time. So I felt that, especially during the times where we had the Black Lives Matter movement, COVID was kicking off. I felt that weight of just being the only person of color, which Danny spoke about. And it's sometimes it's hard to deal with. But I think it's so important for our patients that they see us and they see us progressing, and increasing these numbers of CRNAs is only going to make our healthcare better. It's only going to make it better.
To be heard is to be seen. I'm glad you shared that, man. I'm glad. I mean, like we joke around in my class with my cohort mates and whatever. But like, if I was on the table, right, and if there was a sick provider who would not reach for the first thing, like who would not reach for the razor as the first thing because they can't mask ventilate me, you know what I'm saying. So that would make a difference in my life. Uh, so it is, that those small things, they do matter. They do really matter a lot. So thanks a lot for sharing both. Moving forward, Erica, for you, how did you think like the clinical rotations actually differ from your expectations? Was it all like what you expected, or was it a little bit different? How was it?
Actually, I'm still in my first rotation. I don't go into specialties, I think, until like February, March is what I'm being told. And that's ironically also the time that we're considered seniors. I can't process that information yet. But no, I think that actually is exactly what I was like hoping it would be. The hospital I'm at has also like moved us around a good bit. So like they have, I think it's a big hospital. Like the main OR, I can get taken out to women's and babies. I have not been to, there's like a suburban SOP, suburban outpatient pavilion out there later eventually. Even there's different sections between like ortho, founder, EP lab. I just got to go to EP this week, and endo. So like truly even though I'm in one hospital, I've actually like, I feel like I've already bounced to like 5 or 6 like little mini places in between. And I would honestly say my clinical expectations have been met. And Danny took the words right out of my mouth. You have to give yourself grace. And, Kyle and Taranji, as you two are going into that, I think I remember my first day, and I think my goal was don't cry, do the anesthesia machine check. And 1% better every day will get you closer and closer to that goal. And that has just been really like rewarding for me. And I think like my expectations have been met. Yeah. I mean, shout out to like my program coordinators. I mean, we get really great assignments. To be honest, my clinical preceptors have been really supportive. So it's exactly what I was hoping for, but you never know until you're in it.
Well, that's great to hear that. It seems like you're satisfied with your program. That's always great. That's one less thing to worry about. You can actually focus on thriving and doing, uh, you know, focus on learning. And you're right. We need to have that, growth mindset, but also have that grace for ourselves. It is okay. If today all you did was not cry, that's fine. Not cry. I'm okay. I'm strong.
A win is a win.
A win is a
Amen.
win. It's fine. It's fine. Caitlin, this is for you. So, do you remember a case or any kind of challenge that you faced in these past 9 months of clinicals, which was like, oh shit, and then how did you handle it?
Let me think. I mean, I've had some airways that I've encountered that definitely give you the pucker moment. I've done a very decent handful of ENT cases. So one distinctively, I remember that day we were really like pushing ourselves. All of these ENTs were pretty like lots of tumors, lots of like difficult airways. And we had just been using direct each time. We had backup plans, the whole thing. But yeah, I remember the first time that I actually like went to Blade, looked in and saw nothing. Nothing identifiable, nothing, and I had probably had maybe 150 intubations under my belt at this point. So like I wasn't, still new, but like not my first day. And yeah, it's in those moments where you have to tell yourself, okay, I want to panic, but I can't panic. And what am I going to do about it? So like, having the other CRNA there is fantastic. And you have to learn, especially like now going into senior year. And I've had a preceptor say, pretend like I'm not here, really take this independence and like, what would you do if I wasn't here? So I just did what I would if they weren't there. And I delegated tasks to the other OR personnel. Someone grabbed the glide, I had already had a tube styletted with the hard stylet because I knew at one point during the day it was going to get used, especially on ENT days. So yeah, we just delegated, we did video, and it was fine. And those are the moments that you really realize like it is all on me, but I have backups. This is why I make a plan B. And it teaches you how to not, because as soon as you panic or freak out, even in the slightest, it's like a disease and it will spread to everyone else in the room. And it is really solely our job to keep that cool, calm, collected environment. And I think that's one of the most important things. Even when everything is wrong, it's going to be okay because we're going to fix it. We're going to find a way. And that's it. It is what it is.
Fine. Everything's fine. Everything's fine.
Everything's fine. Everything's fine.
No,
Can I add to that?
Good.
I think it also kind of speaks to like almost the definition of an insanity. Don't keep doing the same thing over and over, trying to get like a different outcome. Like if you can't mask, put that oral airway in. No one's going to fault you for it. If you can't see, grab that video. Like I think it's about patient safety and not necessarily our own pride at the same time too. Like you got to do something. Yeah, there's no ego. You've got to do something different. We're all here for the patient to be safe. And whatever is a safe outcome is the best outcome in my mind.
Yep. It doesn't matter like that we had been DLing all day and like, oh, this is going to really hurt that I have to like go to video. No, it doesn't matter. It doesn't matter. I knew in my head that I had already positioned the patient optimally. So they're already in the optimal position. I had done everything. The blade was in the perfect position. Sometimes you just don't see what you're supposed to see. And that's okay. But that's, again, why we have plan B. And it's okay to take the plan B.
But that's when like, you really, that's when like, in your simulation days, in your didactics days, that's when you really hound on that clinic on that didactic knowledge. So when you do have those moments, there's a combination of your knowledge and then a combination of your personality growth. Okay, I know this is the back of my hand, but how am I gonna process this and execute this? Because the first time I shadowed someone told me that no matter what happens, you are the manager of the operating room. Anything happens, everyone looks at anesthesia. And if you're the one who's losing your calm, everyone it is like a disease. It is like a disease. So
it spreads so fast. Like in my mind, I already knew, well, I can mask this patient. So really it's not an emergency. And secondly, I already laid eyes on where my LMA is. So like even my backups, I already knew in the back of my head, okay, everything's going to be okay.
DEF. Killing it all the time. Love it.
No, that is so true. I remember I was in sim a few months ago, and my NA3, he was walking me through a sim, and he was functioning as my OR circulating nurse, and he just smacked all the OPAs on the floor. He's like, "What are you gonna do?" I was like, "Wait, hold on, what?" Pause, and I was like, LMA?" And he was like, "Well, you don't have an LMA. They don't have the right size. What are you gonna do?" I didn't know the answer, but we finished the sim when we got the patient intubated. But it was just that this goes to show that once you get into clinical, that is really like paramount. Just have your plan A, B, C, and D. So it's good to hear that, Caitlin. It's good to hear. It all comes together.
It does.
So we'll switch some gears and we'll respect the time here. But I want to jump into time management. We'll start with Danny again. How do you manage the increased responsibilities you spoke about, family obligations, and, just life in general? How do you manage that, especially now that you're into your, second year, switching gears, things are getting harder, maybe 4 to 5 days of clinicals, some coursework. How do you manage all that?
Do I manage it? That's the question. No. It's hard because I feel like the way that I manage my time in first year is entirely different than me managing my time having to wake up 4 or 5 a.m. Well, really like 4:30 to get to clinical by 5:30. And then being in clinical till whatever our end time is. And then knowing, for example, this past finals week, I had clinical Wednesday, Thursday, Friday, but then I had finals that Monday and Tuesday. So in order for me to like really like know the material, and I did well in my finals, thank God, but after clinical, I'm chugging a Celsius. Thank you. I'm chugging a Celsius and I'm burning through material. As much as I want to sleep and just like rot in bed and decompress, like I'm getting 10 minutes to decompress and be fully horizontal. And then I have to get up and really burn through like this Anki or meet with my study group and do what I need to do. So I think a lot of the time management is just learning to manage and juggle like prioritization, I would say. Like what's important that I need to do well on this exam, but I also need a case prep for clinical. Does that mean I have to miss the gym today? Does that mean I have to give my mom a couple texts to check in instead of doing like a 45-minute phone call? Does that mean like with my partner, you're getting a 15-minute call before I go to bed and my bedtime's like at 9 p.m. because I have to wake up at 4 instead of me having like a full chat when I get out of clinical. So it's a lot of saying no to things, and it's just the reality of it. Like you can't do it all. And that's something that I had a conversation with my one of the people in my program, because I had bombed one of my exams earlier in the semester. And they're like, you need to learn how to say no to things. If it doesn't fit in your schedule, if it's not part of like your top priority list, then there's no room for it. And the people that will understand. Like your family, they'll understand. You're like in a really high stake situation right now. And if you can't call them Monday to Friday and it has to be like a 10-15 minute phone call on a Saturday when you get a break from studying, then that's what it's going to have to be. And I think that was a hard realization that I had to do with myself and like a check for myself, because I'm like, I can have it all. Like, what do you mean? Like, I have to say no to going to the gym, but the gym's important and I can't talk to my mom for 45 minutes. Like, what do you mean? But I think it's just knowing that this is just like the phase of life right now, right? It's just temporary. It's just the season that it is right now. And it's not going to be like this forever. It's not going to be like this 5 years from now, but in the immediate future, like it just needs to be this way. And I think that goes also hand in hand with maturity. Like if you told me these things when I was 21, I'd be like, absolutely not. But at almost 29 now, I'm like, okay, I can compartmentalize and realize like, this is what I need to do to get it done. And it's just going to get done. So
Yeah, majority of it is also just, accepting it. It is the truth. This is the situation we are in. Like, by the time I'll be done, I'll be in this much debt. I am it. There is no backup. I am it. There is no
like,
backup.
this is me and this is it. And it
This
just is what it
me.
is.
This is it. I remember when I started CRNA school, I was at 180 pounds, peak weight. And now I'm like sitting at 205, and I was just eating some cookies here before I started this. So it's like, you gotta do what you gotta do. When I get stressed, I eat. Some people don't eat anything, and I overeat. So
I wish I had those problems too, but I am a big emotional eater.
I eat.
I second that.
Yeah, I eat a lot. I'm like, it's fine. It's fine. Everything's fine. And I'll work out later. It's fine. I've done it before. I've lost weight once, so I'll lose it again. But it's bad. All right. Moving forward, we'll switch some gears now. Erica, so how did the academic challenges like compared from your first year, now that you're doing like your clinicals, your program is integrated, how did that change? Like, how has it changed for you as you are someone from an integrated program?
So I am historically not a good test taker. I really struggle bus, and I feel like I've always, even in undergrad in nursing, so like again, I think that's giving myself grace. I was always like just hitting the minimums on testing, even in my AS and in undergrad. So I know I'm not going to be like the 95% test taking student. That's unrealistic in my mind, but I wanted consistency is what I really wanted to really go for at this perspective in this time. So I would say actually somehow, not sure how, I actually was doing better this semester than I was my boot camp semester. And I think a lot of that comes with A, it's building. B, I put a ton of extra time into my boot camp semester. And I think I overlearned some things. And I was not someone who was really good at like just learning the PowerPoint or just the study guide. Like I went too in depth, and I've had a couple of my classmates be like, you need to calm down. But I think it finally paid off a little bit later this semester, like to understand that depth. So how, especially this semester was, I think, a little extra hard because we were still 3 days a week on campus, 2 days in class. So it's truly 5 days a week. There were just as many exams, if not technically, I think one more than even our boot camp semester with no breaks and clinical. So how did it compare? It was rough. It was rough. They said this was our worst semester. I feel like they keep saying that to us. To be determined if that's just lingo, or if it actually was. Use your time wisely. I think also I learned about me even a little bit, like how to de-stress after clinical. Listen to your body. I am someone who, again, the workaholic mindset, I actually learned that like if I get more than 6 hours of sleep, I'm a grouch. So like I would rather go to bed at 6 o'clock at night and get up at 2 or 3 a.m. and be fresh and studying than forcing myself to study till 10 a.m., like 10 p.m. And it's not good quality study. Or even like our program made us read the book, Make It Stick. It's hard to transition for like study block for an hour for this subject, study block for this. But I learned if I could even prep 1 hour from prepping Apex before a lecture or just going over a couple extra questions on an exam that was coming up, just getting a little bit of a head start and getting my like gears to work was so much better for me. But it was also harder to keep up that like pace. As the semester went along, I would say like the first 6 weeks of the past 2 semesters, oh, it's definitely kicking my butt for sure. I'm not sure I'm surviving, but the heat was definitely turned up. That's for sure.
It's fine. Everything's fine. It's fine. Everything's fine. I think one thing, and I was actually going to make a video about this, but I can share it here for the people who are actually watching this. What I have transitioned doing is I actually, track cortisol cycles. And whenever my cortisol is the highest, for example, waking up in the morning, first thing, 3 a.m., 4 a.m., that's when I study. And I correlate my study times with my cortisol levels. Whenever my cortisols are highest, I get so much stuff done because I'm so much focused. And whenever I'm like, it's bedtime, I never study at night. That's never gonna happen. Like 2, 3 p.m. I'm like, it's okay. We're calling it a day. We're probably just gonna listen to some lectures. It's fine. But like majority of the stuff, I just rack it up in the beginning at the beginning of my day and just getting it done. So a lot of it is also just about knowing yourself. I mean, nursing school, fortunately for me, I studied, but it wasn't anything like this. But now, I think just knowing myself and, another thing that I've adapted to was first quarter, I really was like, I'm going to get these hundreds, I'm going to get 95s. And it did happen. It did happen because I was like putting so much time into it. But like, as you all mentioned, Caitlin mentioned, you need to live a little bit too. I mean, this is most likely my terminal degree. 81 is what I need to survive and stay in the program. So now I just, hey, I'm passing. It's all that matters. If I get a better grade, it's good. It's good. I have some leeway for final.
It's
That's what I
okay.
do. I do good. Yeah, I do good on my first and second exam. So if I do were to like, screw up a little bit in the final, I have some, something to rely on.
That's the cheat code, though, is to do
Yeah.
so good at the beginning. So then
Yeah.
when finals come, you're not stressed out. You don't have to, you can get like a 40 on the test and still pass the class.
Yeah.
Like, that's the goal.
That's the goal. Just put in the work because final is also cumulative. So if you work in the beginning, it's a little bit easier that way, I guess. But
I think Danny even speaks to usually, not always, not every program, there's usually like a small break. So it's also like you're coming in with a fresh, like, you've had that aha, you can breathe, woosah, bad boys moment. Like, and then you can go into like another 6 weeks of like intense, like, I've got this, bang this out. So I think, again, this kind of brings the whole wellness perspective and getting 5 seconds to breathe.
Yep. That's all. Sometimes that's all it takes. Just like a weekend off or just a week off too. I think we get weeks off in between quarters, and one quarter we don't get any break. But like then they give us 2 weeks. It's fine. Everything is fine. I'm not gonna say anything, but it is what it is. It is what it is.
Well, some programs get like a month off.
Yeah.
And I'm just like, why didn't I
You
know
get a
that?
month off?
Yeah, some programs they get like a month off for Christmas break. I'm like, I'm home for a week and a half, and then I have to go.
I'm currently on like a 3 to 4 week didactic off, but clinical is on. Yeah.
Yeah, we never get that. No.
Sorry, guys.
And say I'm pretty sure it's the
Should've went
last
to
like
VCU.
little break
Right.
because
You're
like
one of the people.
yeah, because starting like January we're 3 days a week, and by like I think the summer we're 4 days a week, and we're like that. Like clinical stays the whole point. So I think this is my last breather, but I'm gonna enjoy it.
Yeah, some programs do get a lot of breaks, and we don't. But whatever the structure is, whatever makes it work, I guess.
This is the hardest time for us because I haven't had a break since June.
Yeah.
So
I'm screaming for you. Stop.
it's 5 days a week. We love it.
Yeah. It was third quarter for me too, and then it was back to back. It was fourth quarter, and now I got this, and now I'm working some shifts, which is fine. But we're not gonna talk about that. But it's fine. I get to sleep, and I don't have to worry about any assignments and studying for an exam. That feeling is really good. So
You could turn your
moving
brain off.
forward, yeah. Moving forward, whose turn is it? It's Kyle. I'm gonna ask Kyle. I forgot it. It was in my head. Kyle. So, how has your relationship? You talked a little bit about criticism, which was really good. Thanks for speaking up about that. But how has your relationship evolved, like with your faculty, with your preceptors, and like with your fellow residents, comparing it from first year when you are all fresh to like now?
I'm a little bit different because I think coming into school, I did a lot of work just to get in and putting face to the name. And I'm in a program where I pretty much know all my faculty. So I think the relationships that I've just started to develop, like it's all just building, and they're watching you kind of go through this process, of all right, we got them in newbie. Like, and just watching you grow and grow and grow, and they give you nuggets, throughout your didactic phase or clinical phase, whatever. Shout out to my program director, Dr. Nikki D'Amico. She gave me so many pearls. Like even before I started, she gave me like a top shelf drug PowerPoint. She's like, "Here you go," because she knew like it's coming.
I
And
thought you
even
said,
after,
I thought you said she gave you a top shelf drug. I was like, what?
No, she gave me like a little PowerPoint. She sent it to me email. She's like, here you go, study your drugs. And I haven't even started yet. It was like maybe like 2 months out, So having faculty like that and they watch you progress over time. I remember even just after my summer semester, obviously I'm still here, but I failed my physiology final in the summer. I was freaking out, panicking or whatever, but starting that, third semester when we're starting to get ramped up, I had a conversation and I was like, hey, like I passed my classes, but like that failure, that hit, that made me kind of like just spiral a little bit. And having those relationships for them to kind of like reel you back in because they've been through it, and I think that, it's so important when you look at programs to see how the faculty interacts with their students. Which is the big reason why I chose my program, just because I saw that interaction firsthand. And I think now going through, I'm starting to really get into it, starting to really learn anesthesia. I think the relationship has gone from, all right, interested student, now you're in, now I'm going to be a little bit more tougher on you. Because now it's like, now you're responsible. Like the stakes just keep getting higher, And I think for that part of it was kind of like a little bit of an adjustment because it was like, okay, this is the person I'm trying to, get to know, developing a professional relationship with. And now when you get to the point where you're in sim and that same person tells you, no, you're wrong. No, you can't do it that way. And they are stern, but that is what anesthesia school is. It's not all fuzzy roses. Your faculty should be hard on you. They're not there to hold your hand when that patient's on the table. They're not, and like they told us, even before going to clinical, I think they had a day in class where they were just like, these CRNAs are not your friend. Don't go to clinical thinking anybody's your friend. They're not your friend. They're there to teach you and they're there to show you the way. And I think now that I'm progressing into my clinical phase, I think that now I kind of look at anybody who's faculty or associated with my program or whoever is a preceptor or a mentor. I look at them like they're supposed to be hard on me. They're supposed to, guide me in the right direction because they want to turn me into, a safe clinician, a safe provider, a safe CRNA, a CRNA that they will want me to put their family member under. That's what they're trying to make me into. And it's going to be hard. It's going to be some feelings that I'm going to have to sit with, but at the end of the day, it's a professional relationship. And I think it's the farther you go into your program, the harder it gets with your faculty for them they hold you to a higher standard. So for anybody who's listening to this, the farther you go in your program, the expectations get higher and higher and higher. And you got to be able to meet those expectations.
But it's really like, it's really for the betterment of us though. Like I feel like they see us and they really want us to be the best providers out there. I see that too, like, in terms of just talking to the faculty and whatever, I feel like they also see their future colleagues in us. So they really give us those tips, pointers, and I think it's you really have to shift into that constructive criticism receiving because I tell everyone you have to be a sponge. You really have to be a sponge and absorb everything because you literally don't know anything at this point. Bottom of the food chain.
And we're paying to be there and we're paying to
Yes,
learn.
it's
So it would be a disservice for them to not,
learn everything.
it would be a disservice to us and to them.
Absolutely. Caitlin, you're almost done with the program. Hey, it's 12 more months, but we're just going to say almost, okay? It's 66% done. Now that you have done good amount of clinicals, you have been through didactics, what do you think success looks like as you are almost at the end of the program? Like being a successful resident, or just what do you think successful looks like, being successful?
I think, and I say this a lot, I think just being prepared. The only things that you can control are being there early, being prepared, and if anything else goes wrong, like it's you yourself were there early and you prepared for the cases that you thought you had. That always can change, but you are prepared for what they can ask you, what can happen, and you're on time. Those are like two main things that you can control. And honestly, and your attitude. And if you show up every day with just those things, you will succeed. I mean, now going into, this will be my fourth clinical rotation. And, I've had the bread and butter cases and all that good stuff and some specialties and all that. I think that, yeah, as long as you show up and you're willing to have a learning attitude and you can get through a bread and butter case on your own at this point, that's a win. And I think our school, like, shout out to our school really, because I already feel, and I still have a year, I feel like after another year, I can step in directly to an independent practice, and feel extremely confident. I'm actually, while I'm home, I'm going to look at a job while I'm here. So, and it's an independent practice. So, and I feel completely comfortable. And that is really to our school, that they provide us 80% independent clinical sites. And I've had such good luck at every clinical site that I've been to with providers and everything. So honestly, use those providers, because they are like, I have just learned so many good things, and it really is about your attitude. So you're not going to win over every person, but if you have that good attitude, they're going to be more willing to give you those tidbits of things that are really important. And just, yeah, like I said, it's very simple. And also I've had a preceptor tell me, that very simple again, that as long as you have the air going in and the blood going round and round, you're doing your job. And it really just comes down to that. And that resonated with me very much so. I don't know if it's just like my ER background, but like, as long as you, again, are prepared, you keep the air going in and the blood going round and round, you are doing your job.
Thanks a lot for sharing that, Caitlin. You should speak more often. You motivate people. That was great. Major shout out to National University. Major shout out to National University and our program directors who work so hard to give us these sites. I always tell people it's a two-way street. We are shopping for programs, and they're also shopping for prospective residents. So really be on the lookout for what you really need from a program. And the more people I talk to, it really comes down to clinical rotations, because this is our time to learn, right? Learn, practice, and this is our space. So really look for programs.
And networking too. Like,
oh yeah,
the attitude goes beyond just like you learning at clinical, but like everyone knows everyone, and you are networking. Like, even when you don't know it, like these could be, the job that I'm looking at is because of a preceptor that I had, and they connected me with a chief. So like it's networking.
it's networking. Yeah, go to conferences if you can. There's a lot of people who are out there to sponsor residents. If you're a nurse, you should definitely go to conferences. Why not go to diversity CRNA, AACN conferences, or AANA conferences? Moving forward, and this is, anyone can talk about this. I'm not going to ask everyone, but anyone can feel free to talk about this. What advice would you give nurses who are considering CRNA school?
I could maybe start,
Please.
at least start this off. So for those of you who don't know, I had to apply to more than one school as well. So my first two applications, I got the straight up no interview, nothing. So I know a few people that are going into like their second year of applications. So one of the biggest pieces of advice I would say is keep going. Follow up with some of your places too. I did have to take a course again. My first application was a little premature, and I had like a CCRN test date, but I didn't have my CCRN. So could I have fluffed my resume a little bit more? Yeah, sure. What was it called? CRNA School Prep Academy helped me, prep for my interview. And I was looking at a lot of those resources and how to tweak my resume. And I've looked at a few other resumes. And again, I'm no program director. I have no idea what they're looking for. But if it's more than 2 pages, I doubt they're going to want to keep reading. Like, condense and put your material together. Be open to criticism. The hospital I was looking at, I had like submitted mine to like my program directors, let them proofread it, reworked it. Every college had like a slightly different like resume and essay letter. Like, usually they want you to tailor it to why do you want that school? And again, like kind of like how Kyle and Tiranji were saying, like, yes, you're shopping for a school, but they're also shopping for you. So like, why do you want them? Tell your why. Your why is also, I think, really, really important, because it's what's going to keep you going throughout this program. It's what's going to motivate you. I definitely support the whole network and connect. I think AANA probably really learned that at the annual Congress with how many nurses came out to that event. Like that was insane as like an SRNA, like seeing some of those numbers and some of those nurses out there. Kudos to who's applying right now, because I think it's way more competitive than when I even was applying a couple years ago. Like, I truly do not understand how program directors are putting these cohorts together because, again, I love my cohort. We're very diverse in age, gender, sexuality, experiences, nationalities. It's really well blended. And again, we all have pretty much the same resume. I mean, plus or minus some initial backgrounds. So I don't know how they're even picking interviews. Like, kudos to them, truly. But keep going. The only way you're not going to get into CRNA school is if you give up. If you want this bad enough, you will find a yes, and you only need one yes for an acceptance. You only need one. And,
Please.
Even like during that learning process and that interview, I think that was actually one of my most like fun times was getting to know the people that were in my interview process. Kyle, I'm going to call you out on this. Kyle actually was accepted to the school that I was at, but, chose a different program. So like, I get to see him now through these conferences and professional networkings, like, be mindful of who you're in. It's a small community and, maybe you don't get into the same cohort, but maybe y'all are going to work together in 5 years. Maybe you're going to see each other at a national or a local conference. It's not a competition. We're all here to succeed and take care of our patients to the best of our abilities. So
yeah, it's
good
crazy.
luck. Keep going.
Me and Danny actually, we talk about this all the time. We interviewed at Villanova together. We were in it together.
Because it was a group like setting where you go, and I was like, thank God I know somebody here.
Because that interview was hard.
Oh,
that was probably the hardest interview I've ever
yeah,
been
that was the
on.
hardest interview that I had for Villanova.
But anyway, to go back to the question, we interviewed at Villanova together.
All right, good.
Yeah, that's in Philly, Pennsylvania.
Yeah, Philly.
Yeah.
All right, to everyone who's listening, better prepare for that interview.
You really got to prepare for that interview for sure.
Before
it might be a little bit different now. They have like different program directors and faculty and stuff. But
yes, but one thing for anyone who is paying attention, it's a one-time only application.
So you get to know.
So unless they changed that in the last few years, you cannot reapply.
One of the few programs that are like that.
Interesting. Wow. Well, before we wrap up things here, I know you guys have to get along with your days. I want to ask everyone, if you weren't to be a CRNA, what other career path you might have chosen? Kyle. You're on mute.
I know I should have stayed on mute because I was thinking. I would say if you want me to say anything fully outside of like healthcare, whoopsie, AirPod fell out. I guess if you want me to say anything outside of nursing, I would probably be a full-time gaming streamer, make a career out of it. Because I really like gaming, and I'll be watching all these people enjoying themselves playing the video games that I like, and I'm just like, man, and they making money.
They're making
playing
bang.
video games. Yeah, making bang, got their content going and all that. So I think that's it. But if it was still in healthcare, probably a trauma surgeon.
Trauma surgeon. Wow, where to go, man? Where to go? All right, Danny, same question.
So if it had to be something in healthcare, I would probably do like veterinary because I love animals and I could still intubate animals, which I think is insane. Or like probably some like plastics, derm, physician type thing like that. Outside of healthcare, I would say I have a lot of friends like from high school that I'm still really good friends with. They work in like public relations, PR, like that realm. Just like people facing and networking and stuff like that. I think it's awesome. They get amazing perks that healthcare will never get. They get free, well, maybe anesthesia does, but they get like free lunches and stocked up break rooms and, all those cool things. So I think that would be fun.
Why not? Erica.
Oh, this is going to be a good one for me. I actually can't say I've thought about this a whole lot, but being the third person to try to think about this in this wheelhouse, maybe like intensive, like critical care NP, because I still really liked being bedside. Mm-hmm. I still really like the ability to use my mind, or maybe some kind of like outpatient injection kind of place or like managing something kind of bigger than that. If it was outside of healthcare, I think it would have to be something with my artsy fartsy brain. I did have like a business, photography business for quite a few years. Didn't love every aspect of it. Always said if I came into money, I would own like a wedding venue. So maybe something like event planning perspective kind of a thing. So I don't know. I never really thought about it for quite some time.
I can see it. I can see it.
I can see it too. Caitlin.
It's funny, Danny, actually. So in high school, this is a fun fact. In high school, I went to a specific high school because I was a vet major. So like I was on the track to become a vet. So that would definitely be one that I would want to do. And outside of healthcare, I think I love to ski. So I would like just be like a little mountain town, like ski instructor. I would love to do that. That sounds great to me.
See that.
Yeah.
I can see that. All right. Before we wrap up things here, one last thing.
Come on, Teron, you got to answer too, man. Hold on. Wait. You got to answer too.
Yeah.
If I was to be in healthcare, I really wanted to become a neurosurgeon. If I had more time, but circumstances, I want to support my family financially, like my parents. I can't be in school for that long, but God willing, in the future, when I do have kids, and if they want to pursue, medicine, go all the way, then I will be there to support them. They won't have to worry about me, in the sense that financially or whatnot. But that is what I would have done. In terms of if this wasn't a thing, which I'm going to do. So I have a passion for singing and music. So once I do become a CRNA, I do want to pursue that. But if that wasn't a thing, I would have got into like fashion, like modeling or something.
You are very dapper, I must say.
I can see it.
Guaranteed at a conference.
I can see it.
That was one of the things. I try to do it all, man. I try to do it all. Okay, so before we wrap up things, you guys are very smart. So I have a question for you. And whoever answers this the first, and you only have like 5 to 10 seconds, you're going to get a special gift, which I will email it to you. But the question is, why don't skeletons fight each other?
Because they're in the closet. Is that one?
No.
Oh, God.
Oh, their bones don't move? I don't know.
Because they're knuckleheads? I don't know.
They're dead.
No, because they don't have the guts.
Oh, my God.
All right, I gotta go.
You're like way off. My brain's went off.
No,
I gotta go. All right, well,
no, I'm out.
Thanks everyone for joining this podcast. Really, really appreciate it for taking out time on this busy day. And everyone who's watching, please subscribe to our channel. This was super fun. Thank you, everyone, and I hope you guys gained something out of this. I will mention all of our Instagrams on the description, and you please feel free to reach out.